So the hospital was being sued, and the lawyer kept on saying, would a prudent nurse do that? So at this hospital, every quarter, yes, every quarter, risk management and legal will come in and they would go over charting requirements and what was acceptable. This was my first time at this hospital because I was a traveler there. And they were very serious about their charting requirements. So they handed us this printout and we were going through a case study. Now, granted, this case study was based on a true story, an event that happened at that hospital. So they had a lot of information to share. The lawyer, as we were reading the signed statements of the healthcare workers, I was reading out what the nurse, the primary nurse, wrote about her account of the situation. And every few sentences that I read, the lawyer kept on interrupting me and asked me, would a prudent nurse do that? Would a prudent nurse do that when she did it? What would a prudent nurse have said in that situation? What would have been the next best step or the next best practice for that prudent nurse to take? And at first I was confused, but then I started getting it. Because you see, that's the legal terms that they use is prudent nurse. So what does prudent mean? Someone that has the ability to make sound decisions using wisdom. Someone who's able to plan ahead for the future. So when he kept on saying it, I got it. I was like, oh, okay. In addition to that, I printed off her charting. And in the computer, especially if you're familiar with Epic, everything is all lined up nicely. The grids are perfect on the computer. But when you print that out, it is a whole ragged mess. Like, I could not understand what the printout was saying, but the notes printed out perfectly every time. So if you find yourself always leaving a note in the flow sheet, I'm just telling you, it doesn't print out that pretty, but notes print out nice every single time. But back to being prudent. The lawyer said, regardless if they find out that the doctor gave an erroneous order and pharmacy still signed off on the order, as the nurses, we're the last barrier between the patient and a medical error that could be life-threatening. And when they are suing and deposing and trying to find fault, at the end of the day, because you operate with a license, the question is going to be posed, would a prudent nurse do that?